Hi everyone, welcome to this video lecture on child abuse. I am Dr. Fawaz Siddiqui from the Department of Pediatric Dentistry. At the end of the lecture, you will be able to explain child abuse and neglect, classify child abuse and neglect, and you will also recognize the role of a dentist in identifying and reporting abused child to the appropriate authorities. Childhood is considered the most beautiful period of one's life. It sets a healthy foundation for a sound future. Children are innocent, they do not understand the right and the wrong, the appropriate behavior and inappropriate behavior, and therefore they are considered as a vulnerable population. Child abuse or neglect is any experience that are threatening or harmful to the child and are a result of acts of commission, that means doing, or omission, that is not doing, on the part of a responsible caretaker. This may include parents, guardians, or any other caretakers. Child abuse is rampant epidemic. It happens in all socioeconomic levels, in all caste and religion, and it is most likely to occur in children below 18 years of age. And dentists are particularly important because at times they are the first to notice a child abuse case. Child abuse can be classified into different types. As you see on your screen, it could be physical, sexual, emotional, or just a neglect, and it is also associated with a syndrome. Let's talk about child abuse first. Now, characteristic features of child abuse are injuries inflicted, which are not accidental, punishment that is inappropriate for the child's age, condition, or level of development. That means if you punish a child which is not appropriate for the child's age and condition and level of development, it's considered as in physical abuse. Physical abuse resulting from parental frustration and lack of control in a fist of anger. That means parents responding in a fist of anger and hurting the child in the process. Injuries such as slapping, punching, shaking, hair pulling, hitting, kicking, biting, choking are all considered as physical abuse. One of the most common physical abuse is where parents or caretakers violently shake a newborn or an infant, which causes an injury to the infant. So most of the injuries in children are facial and head injuries, basically because of the development, physical development, where the head is the most prominent part of the body, and then of course 25% of the cases are injuries in and around the mouth. So can you identify what kind of injury has happened here, which would help you to identify what kind of abuse has happened? So this is an infant, and what you see here, let me switch on my pointer. Okay, so what you see here is the upper gum pads. Okay, and here is what is supposed to be a frenal attachment, and this child was so violently slapped that the frenal detachment or frenal tear has happened. So this is a typical case of a physical abuse where the child has been slapped violently. So what are the indicators of a physical abuse? How do you recognize physical abuse? So remember these 4 points. Number one, explanation of injury given by the parents or the caretaker, which is not consistent with the severity, type, and pattern of injury observed. So the parents may say this is an accidental injury, but you may feel that this is not an accidental injury, it's an inflicted injury. So the parents may say the child has fell off the bed, but you can see the injury which occurs from falling off the bed is different from the injury which occurs when the child is kicked or slapped. So this is how the explanation of injury can be inconsistent. Injury is unusual for a specific age group. Okay, so as you can see in this picture here, you can see this is a bite mark. Okay, so this bite mark will be an unusual injury for an infant, because infants do not go to play school, and they do not go to play school, they do not fight with other children of similar age. So having bitten by a fellow child of the same age can be usual for a specific child of school going children, but it's unusual for an infant. So this is how what it means by injury, unusual for a specific child. Multiple injuries in different stages of healing, which means that the child has been periodically abused, physically beaten, or harm, and then you can see the different injuries are at the different levels of healing. So this is an indication of a physical abuse. And of course, lastly, specific bruising patterns like child hit with a belt or a bite mark or a cigarette burn can be easily identified. So you can see in this child here, there is a cigarette burn on the child of the face, and this is scalding when the child's hand was put into boiling water as a punishment. So these injuries are specific injuries, unusual for the specific age group, cannot have the child can burn both the hands with such severity, and therefore we need to look at these indicators to come to a diagnosis of physical abuse. But hold on, there are more indicators of physical abuse. Behavioral indicators of physical abuse. So if you see, there are 4 indicators here on the sides of the arrow, which can be a sign of a behavioral pattern or behavior shown by the child who is physically abused at home or at the caretaker's house. Poor performance in school, undernourishment, poor overall care, running away, wary of parents, fear of touch, unduly afraid and passive child, dramatic mood changes, aggressiveness, cries easily, suicide attempts, withdrawn, depression, no eye contact. So these behaviors, along with the physical indicators, is a strong case for a child who is having a child abuse. So both of these you must keep in mind and you must correlate. Now we come to the part of sexual abuse. Any sexual stimulation activity that is inappropriate for a child's age, level of cognition, or role within the family is considered as a sexual abuse. Most of the offenders are related to the family members, and most of the offenders are males, and of course the victims are females, infants and adolescents. So we have to be very careful when we are investigating or we suspect sexual abuse because of the sensitive nature of the abuse. So most likely for dentists we will see trauma around the mouth, okay, and therefore we should be vigilant that the physical abuse may be caused by kissing, fondling or intercourse or pornography or rape of the child. So again, our word of caution that we should be very sensitive to these kind of abuses. Lastly, we come to the emotional abuse. Here there is no physical contact, but it's only by word that the child is getting harmed. So it involves interaction or lack of interaction. That means either you say bad things or you shout at the child or you neglect the child, don't talk to the child. So this is lack of interactions on the part of the caretaker that inflict damage to the child's personality, emotional well-being and development, and this is not one time, it has to occur over a period of time to cause damage to the child. And examples are continuous isolation, rejection from the parents, degradation at school, terrorization and bullying at school, exploitation by family members, and denial of affection by family members, especially the mothers and the fathers, the parents. Okay, so these kind of abuses can lead to a personality damage to the child, a personality defect in the child. So again, we have to keep this in mind when you're considering any abuse to the child. We come to neglect, when which basically means that is the caretaker is not, or the parent is not fulfilling the basic needs of the child, and therefore the child is getting neglected. So either it could be a physical neglect when the child is not bathed, clothed and kept warm, or it could be a health neglect where the child is not taken care of medically or dentally, or it could be a educational neglect where the child is not sent to the school, or safety neglect where young child are left unsupervised at home and they get injured in the process. So these are kind of neglects that can occur to a child. So we will concentrate on dental neglect, and dental neglect is the willful failure. That means the parent or the guardians are aware and they do not act. And what do they not act? They do not act to seek and follow through with treatment necessary to ensure a level of oral health essential for adequate function and freedom from pain and infection. So if a child is not brought to a dental clinic and the parents know that he needs dental care, is a case of dental neglect. Some examples that indicate towards dental neglect is untreated rampant caries that is easily detected by a layperson, untreated pain, infection, bleeding, or trauma affecting orofacial region, or history of lack of continuity of care in the presence of previously identified dental pathology. So if you tell the parents that this child is having a dental-alveolar abscess and we need to take action, and then you find that even after 6 months no action has been taken, this could indicate towards a dental neglect. There are certain syndromes which are specifically associated with dental neglect, and this particular syndrome that you see here is very popular as a question asked in the exams. And this is a condition where the perpetrator, usually the mother, relays a fictitious history, produces false signs and symptoms, fabricating illnesses in the child, and that results in extensive medical evaluation of the child and testing on the child, and often prolonged hospitalization of the child. And in the end, the healthcare provider is not able to find out what is wrong with the child, and the mother keeps giving you false history. Okay, this can happen for the following 3 reasons. It could be a way of gaining medical attention for the mother, it could be a psychosis, parental psychosis, or it could be a fraud to obtain money or services or insurance claims. Okay, so recurrent illnesses which cannot be explained, signs and symptoms do not make sense, and the bizarre history is a case for this particular syndrome. So what do? We can identify a possible abused child, and we must be knowledgeable in recognition, documentation, treatment and reporting of suspected child abuse cases. To appropriately intervene, professionals like us must be willing to consider abuse or neglect as a possibility. If not considered, it cannot be diagnosed. So we must be knowledgeable in recognition of cases, abuse cases, and we must know how and where to report it. So let's see how we can do that. So there are certain clinical protocols if you're suspecting a child of physical abuse. So like we have discussed, there are physical indicators and there are behavioral indicators. So what do you do when you find you're faced with a situation where you feel a child is physically abused, emotionally abused, or sexually abused? Okay, so let's take physical abuse, which is the most common type of abuse and which can be identified and diagnosed. So if you find a case such of physical abuse, then you need to take a detailed medical history. You need to communicate with the patient, talk to the child to clarify possibilities. Of course, if the child is able to talk to you, is able to communicate to you. If not, then you go to physical examination. You observe the child's posture, gait, clothing, examine entire body that is exposed. Don't ask the child to take off the shirt on the dental chair, but if you suspect, then you may ask the child to take off the shirt, look at the back, look at the chest, and loss of hair. Any deviated nose indicates previous trauma to the face or to the eye. And dentally, you must check for missing teeth, previously traumatized teeth, soft tissue injuries, very very important, such as torn frenum, petechiae on the palate, and mandible and maxilla. So these are the clinical protocols, the evaluation that you need to do when you suspect a child or who is physically abused. So what do you do? Okay, so what you need to do is you need to first complete the dental treatment, okay, and then make a medical referral. You write down all the data collected, take the photographs and note the child's behavior. Then you report to Child Protective Services of agencies or law enforcement officials, okay, else you will be criminally charged for not reporting a child abuse. And if later anybody finds out he has been abused and the child had been to you where you failed to recognize, you will be charged as a criminal. Parental concern: the parent should be told of possible abuse but do not make any accusation about who may have caused it. However, some situations may be handled without informing. So depending on the level of child abuse, you must talk to the parents. So sometimes it is the stepfather who is abusing the child, so you have to talk to the mother that the child is getting physically abused or sexually abused. So in these situations you have to talk. But if you feel that the mother herself is abusing the child, then you may not inform the mother but report to the relevant authorities who may come investigate and find out. So it is our obligation to strictly maintain confidentiality of all the records. All the photographs that you take, don't share it on Facebook saying that I've seen such and such case. Don't do that. Maintain confidentiality and share the photographs with the relevant government authorities and Child Protective Services only. Children with special needs are particularly vulnerable to abuse because these are the children who are not wanted by the parents because of the disabilities that they have, and they are difficult to take care of. So the caretaker may get frustrated over a period of time taking care of the child and may start physically abusing the child, or the child with special needs may be exploited for sexual pleasures by sexual abuse by one of the family members or the person who knows the child. Okay, so keep in mind, when you're differentiating injuries, you must also look at cultural practices and folk medicine because they also produce injuries to the body. For example, cow, where hot coins are rubbed over the back or the chest to cure fever, or cupping, where the warm cups are placed over the chest to draw out illness. So this may appear as an injury, but you must be also aware of the cultural practices and folk medicine in your area so that you can differentiate and not cause unnecessary panic to the parents or in the society. So in the Malaysian context, I just pulled out a figure which is a little old, 2018, and you can see that the incident of physical abuse has been on a rise. Okay, sexual abuse has been on a rise. Of course, emotional abuse has reduced. Negligence has reduced. Abandonment by the parents have reduced by the others. So anyways, you look at the physical abuse and sexual abuse, they are on a rise. So we must be in the Malaysian context. In Malaysia, you must be aware that it's very, very common practice. Okay, so how do you report and who do you report? So in Malaysia, you are supposed to call the Childline Malaysia number 15999, and then you have to make a report there. So this is a Childline call center. It's 24 hours. You can call in and report, or if you want to talk to an official, this is a telephone number that you can call. The email is here, and of course the office is in Shah Alam, Selangor. So this is very, very important question for your MCQs, where you have to be aware of this number. It's very, very important. Okay, so to summarize, we need to learn to recognize the signs of abuse so that we can take appropriate action. We must also be aware of Child Act 2001, which says that any medical officer or a medical practitioner or a child care provider, if he does not report a child abuse case or even a suspicious child abuse case, that person can be criminally charged in court of law. Okay, and for us, we should not hesitate in reporting an abuse, even though if it has happened in the past. Okay, the abuser may still be active and around the child and may cause abuse in the future. And the good thing about reporting is that if you suspect a child abuse case, you just need to report it. You do not need to prove it. Okay, the child protection agencies will investigate and will find out. Okay, so you will not be questioned on how or why, but you will not have to prove anything. Okay, all you need to do is, if you're suspicious, you report it. So if you report one case and you indeed find the child is abused, the child's life is saved from, and child's mental health is preserved. But if you do not, then of course you will be criminally charged. So do not turn a blind eye. It is our social and moral responsibility to get involved and protect this vulnerable population of the society. So with this, I end my presentation, and we have to be very vigilant and take part in stopping child abuse in the society, maybe because we may be the first responder to a child abuse case. So thank you so much for listening to this video lecture. If you have any questions, you can find me on my email on the e-portal, or you can find me in the clinic and walk up to me and ask a question, and we will discuss in the clinic as well. So that's all from me. See you next time in the next video lecture. Bye bye.